Hey, good afternoon, and thank you for joining us for this cell phone town hall. If you have questions at any point, you can press 0 to be entered into the question queue. Over the last several weeks, Montanans have certainly faced unprecedented challenges, and our way of life has changed. Like every state in the country, our once thriving economy is ailing, and we've lost family members and friends and people in our communities. And I've said it before, and you'll hear me say it again. In times of crisis, Montanans have always pulled together, and this time has been really no different. Back in March, we knew that if we did not act, there'd be dire consequences. That's why on Thursday, March 12th, we declared a state of emergency before there were any confirmed cases of COVID-19 here in Montana. Just a few days later, after that first confirmed cases of the virus in our state, we made the decision to temporarily close our schools and allow for remote learning. On March 20th, we announced the closure of higher-risk businesses such as bars and restaurants, gyms, and movie theaters. And on March 27th, Montana entered into the stay-at-home order before over half the states in our country did so. We really have been aggressively managing the virus, and when I say we, I mean not just folks in Helena or local health officials, but all Montanans. And as a result of the actions that we've collectively taken, we have among the lowest number of COVID-19 cases in the nation, and indeed of all the states, the lowest percentage of positive cases per capita or when compared to our population. Montana also has the lowest number of hospitalizations per capita in the nation. In short, we have flattened the curve and we have saved lives. Earlier today, I announced that the collective actions and efforts of Montanans have allowed us to get to where we are today, and that's to begin a phased reopening of the state. And while there's reason for optimism, there's not necessarily a time for celebration. Asking Montanans to continue to go to great lengths to protect one another, because once we begin to reopen, we want to be able to stay open. Our personal responsibility to protect those around us, particularly those most vulnerable, remains just as important now as any time during this pandemic. Montana's plan to reopen, it's posted online at covid19.mt.gov. Imagine a lot of the questions that people might have are answered by those documents, but it includes the steps we'll be taking starting on Sunday to reopen, includes specific guidance for businesses and others to follow to keep Montanans safe and healthy. We'll begin the first phase of the plan beginning this Sunday, and that's when the shelter-at-home or the stay-at-home order is lifted, of the expectation that people still social distance and you're not out in groups of more than 10 where there isn't social distancing. Place of worship can become operational this Saturday. However, still, even, you can be with your family, but to protect the overall congregation parish, we encourage social distancing. Main Street and retail businesses can open under different guidelines than they used to be, for sure, starting on Monday. And you're still going to have gyms and pools remaining closed for now, as other places of assembly like movie theaters, concert halls, and bowling alleys. As of April 7th, so for 2 weeks from now, schools will return to decision-making by local school boards, meaning that about a month ago that I put out a directive closing all K-12 schools in the state. Now then it's going to go back to local school boards to make decisions. Additionally, we are instructing all vulnerable Montanans, though, who really are at most risk with this virus, to continue to follow the stay-at-home directive. Strongly encourage everybody on the call to take a look at what we're asking of individuals and of businesses and others. Like businesses, for an example, still teleworking every time that's possible and feasible. Encourage business owners to read the guidance posted on the website to make sure that they can comply with the new requirements that are lowering capacity and requiring social distancing. And we are relying on every Montanan to continue vigilance and hand washing, sanitizing, staying at home if you're sick. Call a provider to get tested if you're experiencing COVID-19 symptoms. Minimizing non-essential travel. And additionally, visits to Montana's nursing homes will continue to be suspended except for certain compassionate care situations. Our senior and assisted living facilities are among the most vulnerable places for cluster outbreaks. And I can only imagine how hard it's been for our legacy Montanans to be isolated as they have been. But hopefully to know that these steps are to keep them safe. Even as we begin sort of a phased approach to reopening with these steps in phase one beginning this Sunday, we're not out of the woods yet with COVID-19, and our new normal is going to look different. Virus isn't gone from Montana. So as we turn to support our Main Street businesses and get more families back to work during this time, as we should, we also have to make sure to be looking out for those around us and protecting everyone around us. We're going to be monitoring cases closely and carefully. We need to see how this first phase works for Montana in line with our continued efforts to slow the spread of this virus. Again, this phased reopening plan and guidance for individuals and for impacted businesses can be reviewed at the covid19.mt.gov website. Now I'd like to take the rest of our time together this afternoon to answer questions from those on the line. I have members of the state COVID-19 task force, experts in public health, emergency response, economic development here with me today. Lieutenant Governor Cooney will be moderated and more or less also includes Adjutant General Matthew Quinn, the Department of Public Health and Human Services Director, Sheila Hogan, our State Chief Medical Officer, Dr. Greg Holzman, the Director of the Department of Labor and Industry, Brenda Nordlund, and our Department of Commerce Director, Tara Rice. So that will now turn it over to your questions. Again, if you'd like to ask a question, press 0, and you'll be entered into that question queue.
Thank you, Governor. The first person on the line is Drew from Whitefish.
Hello. Thanks for taking my question. I've read the material that you presented earlier today and also the lighthouses, and I don't see any timing between phases. Can you give us some guidance as to what your length is between phases?
Yeah, and thanks for the question, Drew. And it's hard to put, like, here are the hard and fast dates of when things happen because, you know, when you think about it, this virus, COVID-19, can be anywhere from the time that you might have had an interaction with somebody or been positive. In some respects, we're looking up to 2 weeks backwards. So that we haven't, for how we get to phase 2, said, here are the timelines for when this may happen, because what we have to do is assess both how much that we're getting additional cases, where those cases are coming from, how much of it is by the spread is from some of the areas, candidly, where we opened up now, and be making an assessment guided by the data along the way and what's happening on the ground in Montana to make those next decisions. And we're also relying a lot on local public health officials as they work to do contact tracing. When we get a new positive case, for example, to be reaching out to see who all else might have had exposure to that individual. Should also noted, which I didn't in the opening, that this is like our statewide, but I know that, look, from tribal nations to local public health officials, they're also going to be assessing what's on the ground in their communities. And at times that some of the actions and activities taken may be different than what we're proposing.
Thank you, Drew. The next person is Steve from Billings. Steve, go ahead.
Hey, Governor, how are you doing today?
I'm doing okay, Steve. How are you?
Well, good. I'm a concert promoter in Billings, and my question was about venues like performing arts theaters and arenas. If you know what the restrictions might be, and if you do, how far in the future will they go?
Yeah, so thanks for the question, Stephen. For this first phase, the larger place of assembly, like a concert or even movie theaters, still remain closed. What we have in there for individuals, too, is gathering of 10 or more, unless social distancing is possible, is still discouraged. And into the second phase, then, what we look at is gatherings of up to 50. And the third phase, then, would be completely back to some normal along the way. So I think for concert areas and venues, it really depends on what's happening in these initial steps as well when we can get to reopening under any sort of new normal. But look, there may well be, until this virus goes away, some differences and distinctions as we try to look at, just as we're looking at churches and others, of social distancing. Until we fully get our hands around that, I think that even the way that you've operated businesses may be different going forward, Steve.
Thanks very much, Steve. Linda and Helena, you're up next.
Yes, can you hear me? Yes, I want to see if you are in favor of mail-in balloting if it comes to that.
Thanks for the question, Linda. And for the primary election, several weeks ago, I turned it back to, or I said that each county can make the determination whether they want to do mail-in balloting. And every county in the state said yes. So there will be mail-in balloting, mail-in ballots starting 30 days out from the June primary. But it's not just, well, and also I guess with those ballots too, that often, like if you're absentee voting, you have to put your own stamps on it. That won't be necessary this time. But the other thing is that won't be the only way that one can vote, because we also know that, you know, there are some folks that don't have street addresses, for example, or there are some other challenges along the way. So we want to make sure everyone has the opportunity to vote. So there'll still be the availability of dropping off ballots, either at the clerk and recorder's office. In some areas, there'll still be satellite voting locations as well. So that's a long way to say that, yes, every county has said that they're going to go to mail-in balloting. That's not the only way that you can vote. And that's what the decision has been made for this June election.
Thanks, Linda. Tom in Great Falls.
Hello, Governor.
Hi,
Tom. I had a question for you. Is the state prepared with antibody testing to support our local public health officials to get the people on the front lines and the first responders to help them see if anyone's been exposed or immunity in case there is a second wave, so that we know if we're protected or at least would have that in the back of our minds?
Yeah, and thanks for the question, Tom. When it comes to antibody testing, that the FDA is just now looking at what tests might be effective and approving them. And asking our first responders, like one of the directives, example, with the first responders were that if you're showing up at a household, COVID-19 positive household, the dispatcher will actually tell you that they have that information, so to try to protect them along the way. So we're going to continue to, as we have, put an emphasis on trying to get the tests and the resources that we need along the way.
Thanks very much, Tom. Rita in Columbia Falls, go ahead and ask your question, Rita.
First, I'd like to thank you very much, Governor, for taking such good care of us. I have acquaintances who have been wintering in the South and are ready to head for home in Montana. Should they be self-quarantining after they arrive?
Thanks for the question, Rita, and more than just me, thanks Montanans for taking such good care of one another. As we've listed, as we look at this phase one, we're still saying that if you're coming from out of state, either like your direct question, acquaintance who's wintered in the South and wants to come back home, or if someone's going to visit Montana for non-work-related purposes, the directive that still says you must quarantine for 14 days is still in place. We want to make sure, because Montanans have done a lot to try to slow the spread of this virus, and we don't want it just wide open again at this point where others may well be bringing things in from other states, which could add to some of the local and community spread. So that your acquaintance, if they're after wintering, when they come back, they should quarantine for 2 weeks.
Thanks very much, Rita. Jim in Kalispell. Jim, you're up next.
Hi there. My question was, after seeing the fact that there's been like 11,000 tests in Montana and about 430 some odd positives, what is the difference in those two numbers? It sounds like an awful lot of people have been tested, and have all these people that have been tested called in like with high fevers and coughs, or have some of this testing been on the basis of, I'm curious if I'm positive or not? I'm kind of wondering what the guidelines are, and when, as citizens, if we want to test, we could get a test without necessarily having to be being in the throes of all the symptomology.
Sure, and thanks for the question, Jim. And I'd also note that, like, at the website, the 11,000 that you see, those are all that have gone through our state public health lab. There's been some tests that have gone to private labs sent by hospitals. So there's probably about another 3,000 of those that at least we're aware of that were sent to other places. And then the 433 is whether you go through the state health lab or a private lab, they have to report the positives. So directly the question of what the testing criteria is and what will it be. What the testing criteria is as of today is that if you have symptoms consistent with COVID-19, to reach out to your local health care provider or your doctor, and we are encouraging everyone with symptoms to get tested. Now, that doesn't change your actions as much as that if you have symptoms and you're waiting for a test or others, that would still ask you to quarantine at home. As far as when we'll get to the point where anyone that wants a test can get it. Look, and earlier today, as an example, I'm on a weekly call with all of the governors. Every governor is working to try to even further increase the ability to test. And that takes not only the testing kits, but also the supplies and the swabs. We got another, 5,000 swabs just on Monday. We haven't gotten a place as a state or as a country where anybody that wants to test can get it. But we'll keep fighting to try to get more testing capabilities along the way, recognizing that right now, if you have positive symptoms, we're highly encouraging people to get a test.
Thanks very much, Jim. Bill in East Helena. Go ahead, Bill. Go ahead, Bill.
Yeah, my question for Governor Bullock is, I'm self-employed and I've applied for the unemployment insurance, and I've been trying for 3 weeks to try to get into the unemployment office in Helena, and I'm unable to do so. I'm just asking for any help or any advice on how to get a hold of those people.
Yeah, and Bill, thanks for the question. And, you know, it's been about a week since we even got guidance from the federal government as far as what we can do for self-employed. What I'll do is turn it over to Brenda Nordlund, who's the Commissioner of Labor and Industry, to answer your question.
Hi, Bill. This is Brenda. Thanks for asking the question. And I appreciate your patience. I know it's been very difficult as we've worked to bring up this brand new federal system. You may be getting an email from me today or from the Department of Labor today advising that you should file for self-employed unemployment, pandemic unemployment assistance through the new standalone system that we just set up. That information is available on the web. It is also available in the email and any social media that you might be following. This system will be exclusive to the individuals who are self-employed, the independent contractors, the folks who have special circumstances due to COVID-19, like they can't work because their children are out of school or a caregiver can no longer provide care to a dependent adult, those kind of reasons. And our anticipated timeline for being able to issue payments, including the extra $600 to the eligible candidates under this program, is May 1st.
All righty. Thanks very much, Bill. Tony in Park City. Tony, you're up.
Thank you. My question is related to testing as well, and I was basically interested to know what our testing capability actually is in the state, and if, and I think this one's sort of been answered, Governor, if you feel like you've had coronavirus and you want to get tested, where do you go, and does it cost you?
Yeah, thanks for the question, Tony. So even through this past 5 or 6 weeks, that we've been great in as much as the State Public Health Lab has been able to turn around all the tests that it receives each and every day. So that ability hasn't precluded us from going forward, and that there are the testing supplies, because it's not just the processing those tests all throughout the state. So if you have COVID-19 symptoms right now, you should reach out to a healthcare provider or community health center or others. As far as the cost, it does not cost individuals, meaning that all health insurance plans have waived costs, that Medicaid and Medicare have waived costs as well.
Thank you very much, Tony. James in Big Arm. James, you're up.
Hello, Governor. First of all, thank you for your courage and your common sense. We're going to miss you, but you're going to be a great addition to the Senate, that's for sure. My question is this. I am the founding director of a very large arts and education nonprofit out of Missoula Children's Theater, and we have, in effect, been shut down, of course, and we've had to lay off well over 100 full-time employees. I'm wondering if you know of any financial assistance at the state or federal level for nonprofits.
Yeah, thanks for the question, James, and also thanks for being the founder of Missoula Children's Theater. It's a pretty amazing place. So there are a couple different things. One of which is through the Small Business Administration, just like other businesses of 500 or fewer employees, they can actually go through to the Paycheck Protection Program. So I'd encourage you to first reach out to your local banker. It's the best way to do that. And, I think it just passed the Senate additional dollars into that Paycheck Protection Program, which is a federal program run through the Small Business Administration to address some of those needs. And then as we go forward, too, we're trying to look at what any additional supports there can be for sort of both the nonprofit and social services sectors.
Thanks very much, James. In Laurel, we have Margaret. Go ahead, Margaret.
Yes, Governor. I wanted to talk to you about relaxing the policies for the state of Montana. I'm afraid with the relaxing of the policies for the state of Montana is going to cause a lot of more sickness for the virus and one thing and another. I understand people that need to go back to work in order to make a living, but I'm concerned about not only the elderly people, but I'm more concerned about the young children. And I was just recently in a store that did not have any mask on, did not have any gloves on, and they were walking close together. And I just wonder if that policy shouldn't be still held in effect, wear a mask and gloves when you're in public.
Thank you for the question, Margaret. And yeah, in part, look, to have a healthy economy, that we have to have a healthy population. And we know that as we lift some of these restrictions, we will see cases. And what we are trying to do is take the most measured approach and then also work to where we see additional cases, take the steps along the way to do everything that we can to contact trace and find anybody else that might have been in contact with somebody positive. But to the point of included still is the encouragement for individuals as they're out in places like grocery stores to wear masks. And the face coverings, non-medical face coverings, by and large, protect everyone else from you in the event that you would be COVID-19 positive, more than stopping the spread altogether. And it is one where I will still encourage local doctors and our county health organizations will encourage people where social distancing isn't possible to wear masks or wear face coverings, if you will. And we all, as Montanans, got to work toward having other Montanans try to take care of one another. Now, that doesn't mean everybody will comply. Not everybody has complied with these directives we put in before. But I am so encouraged and inspired by all that everybody's done along the way, and still asking Montanans to help take care of Montana.
Thanks very much, Margaret. Appreciate the question. Now to Jeff in Eureka. Jeff, you're up. Jeff, are you there?
We might have lost Jeff. Oh, Leah.
Leah from Laurel. Leah, go ahead, Leah. Hello, Leah. Are you there?
Yep. Hi, this is Leah from Billings.
Hi, Leah.
Hi. First of all, thank you very much, Governor Bullock, for all you've done for Montana, and thank you to the Montanans who have been supporting each other all along. I personally know that we do need to take this seriously. My hometown is Shelby, Montana, and I know people from the nursing home there that have passed away, so I appreciate that. Secondly, I'm a teacher at Shepherd Elementary, and I'm just so impressed by the administration, the teachers, the parents who are working full-time helping us, all these healthcare workers, and especially my kids, who one of them has even sent me a mask. that she made. But my question was, if we do end up that our school decides to go back without being just online, I'm wondering about your policy about what would be an example of a mix of in-person and remote learning. I guess that part of the policy I didn't understand.
Sure, and thank you for the question, Leah, and thank you also for being a teacher. And I know that I have no doubt it's great to hear as one of your students sent you a mask, that I know that students have been wondering, and just as teachers have been trying to take care of their students during this time, students have also been wanting to take care of their teachers. And I think that it can be in any number of ways, one of which is that, and those are the discussions for your local school board if they choose to reopen. That could be anything from the perspective of that you are at times then, you're certainly changing, working to incorporate social distancing, but maybe it's not every single day. Maybe it's some days where you're in class and others where you're at home. Maybe it's for vulnerable teachers. We've had all of the kids at home and the teacher doing something online. Maybe the kids end up at school and the teacher's at home. And the encouragement is really just that we put out some considerations, some best practices that we've been hearing from around the state and the country, and then just as you work every single day to say, how do we unleash that creativity of our kids, to have the school board and administration and teachers to say, if we so choose, to reopen, because it is the choice held by you all. What I did is lifted that state directive 2 weeks from today to be brainstorming, thinking of ways that you might be able to change what the model that we've looked at in the past, recognizing that there's other issues still continuing with the possibility of coronavirus.
Thank you, Leah. Sorry I got your town wrong, but we will move to Elizabeth in Billings. You're up, Elizabeth.
Yeah, I need to find out how to get in touch with the IRS. I have an issue with my 2018 taxes. They have the wrong bank information on it, and my 2019s are not done because I had to mail them in. And so I've been trying my hardest to try to get things done to be able to get the stimulus check here. I'm running out of ideas of what to do.
Yeah, Leah, one thing that, and I don't have that direct interface with the IRS, but one of the things that you could email at governor@mt.gov, and what I'll do is have someone from sort of the Office of Constituency that's trying to help address all these problems, reach out to you.
Thank you, Elizabeth. Jacqueline in Bozeman. Go ahead, Jacqueline.
Hi, Governor. I want to tell you that there are people all over this country that are anxious for you to be our next senator, so including me. And I am not a native Montanan. I've only been here about 27 years. But a little bit of my profile is that I'm a senior citizen. I'm self-employed. I'm not retired. I'm from New Orleans. My 98-year-old mother is confined in her house, and she does have her mind, and I'm afraid she's going to have to be stuck there till her 100th birthday. And I'm hoping, like Margaret, that you will not relax these restrictions because they've been successful, and it's worth waiting. Our health is, more important than the economy. I mean, I know the economy is very important. I know I'm going to lose money, but I wanted to come up with a few questions and suggestions, and that is, first of all, I have a close friend who's a doctor in New Orleans, and he told me that testing is only as good as today. If you find out today you're negative, it doesn't tell you what tomorrow is going to be. And therefore, everybody should treat it as if you're negative and everybody else is a positive, and you should stay in your bubble. And that's what I hope to do, and that we all stay healthy that way. And I had a conversation with someone yesterday who was like an idiot saying, well, if I die, I die. I mean, we really need to have more restrictions. And with the jobs, there are hiring signs all over Bozeman, and so I think people can get jobs, but specifically, have you heard of the program that the World Kitchen has where they implement restaurants to use their kitchens and their staff to provide meals for people who don't have jobs and then be reimbursed by FEMA? And my second question is, I heard you mention being on conference calls with governors. What are you all doing coordinating, considering the abominable lack of leadership coming out of Washington? Thank you very much, and I can't wait to hear our senator.
Jacqueline, first to your point of testing's only as good as it is today. I mean, that is true, meaning that you could end up testing thinking that you're negative, and 2 days later, it could actually then end up that had you been tested 2 days later, it would be different. So the advice really is for anyone that has any symptoms, not only to test, but also to quarantine. And the question of like how we're collaborating with other governors is in a number of different ways. One is at a sort of aggregate level, every single, and last year I was National Government Association chair, so still part of the executive committee. Every single week we have at least one call where we talk about some of the things that are shared to us or some of the challenges that we as governors are raised in the federal government, but then open it up for any of the governors to speak and both ask questions and talk about best practices, talk about concerns that we have. That is, in some respects, when we've pushed for additional testing and additional supplies, it's been uniform from the federal government. And it's not just sort of that institutionalized side. We also have at least one call a week, all of the governors with members of the federal administration. And I'd say that there's probably, like last night, I was on for 30 minutes with the governor of Illinois. And we were both talking about different things that are happening in our state and sharing ideas, sharing concerns, and sharing ways to go forward. So it's one where I think that each of the governors, as the mantra from the federal government has been that this is locally executed, state managed, and federally supported. The governors, when we felt that it would be nice to get more support or concerns with the federal support that we've collectively, Democrats and Republicans, raised concerns, and then as individual governors are doing the management side at their respective state levels in conjunction with local public health and others, what we've done is often shared collaboratively and also shared best practices.
Thank you, Jacqueline. We now have Harry from Livingston. Go ahead, Harry.
Yes, Governor, thank you for taking my question. And my question is about reopening Yellowstone National Park. And I'm concerned about it being reopened in that we live in a small community, gateway to the park, and with tens of thousands of people coming in, I think that would really be a bad idea. We're just inviting everyone in the world to come here. And we don't have the facilities to take care of the spread of the COVID-19. And my question is, can you do or will you do anything you can to persuade those responsible for making that decision? If you would try to persuade them to not open Yellowstone National Park.
Yeah, Harry, and thank you for the question that we still have in Montana, too, our 2-week mandatory quarantine order if people are coming to Montana for non-business purposes. Now, I recognize that all of the orders are only as good as people comply with them. I will tell you that this week alone, I've had conversations with the superintendent of Yellowstone National Park. I've had conversations with the governor of Wyoming as well, because Wyoming and that governor's the next or equally impacted by Yellowstone National Park. And I certainly hope that any decisions that are made as relate to the park will be collaborative decisions, so that while the federal government could come up with sort of here's what it thinks on its own, that I trust that the superintendent would be consulting with us on a regular basis before the Yellowstone National Park made any decision. So we'll continue to be in conversations with them.
Thank you very much, Harry. Carol in Missoula. Carol, you're up.
Yes, I actually had the same question as one of the other women about wearing masks in public. And, of course, I really encourage it because, I was at the hospital to get an infusion this week, and everybody had a mask on, and I felt safe there. But I realized, being out in public, even though we were all really trying to practice social distancing, how hard it is because, you're waiting in line, or you're trying to, pass somebody who's sitting in a chair or something like that, and we pass each other in public. So I guess I would encourage wearing masks and gloves. And also, I was really worried about, the virus returning, getting what they call the second wave. And, I was just wondering, if you're ready to say, okay, wait a minute, we tried to get the economy started, that we have better back off a little bit, So anyway, that's about the essence of my question.
Yeah, and thank you for the question, Carol, that we still are encouraging where social distancing isn't real possible or practical for people to have face coverings or, a cloth mask. So encouraging individuals to do so in grocery stores and other places where people gather. And to the second point of like a second wave, just to be like, we really have, Montanans have done a great job of tamping down the number of positives that we're seeing. But it's not like this virus is gone by any measure. And I do anticipate that we'll continue to see positive cases in the weeks and months ahead. And what we're trying to do is, we can take pleasure that we have among the lowest hospitalizations or the lowest per capita and the lowest positive cases. That doesn't mean that as individuals we should be any less careful and concerning. And it also doesn't mean that, we'll continue to, at the state level, and working with local public health officials, working with hospitals, working with others, monitoring what we're seeing on the ground as we make decisions going forward.
Thanks very much. Next we have Catherine from Billings. Go ahead, Catherine.
Well, thanks for taking my call first. I'm wondering with the tourism that's supposed to be coming up, and I know the subject's come up already, but widespread rather than just Yellowstone Park, we draw millions of people from all over the world. So there's that, which is just weeks away, and there is what it is now. We are considered to be less of a risk than any other state, so I'm sure that's why you're considering opening things up. But even with that being the decision, obviously, that's already been made, it seems to me that everything I've heard and everything you've said pretty much leads us all the way down the path of not a good idea. So what do you have to say about both those things? Tourism and this incongruity with what you're saying, answering these questions, and then what you're doing.
Yeah, well, and thank you for the question, Catherine. And, we are trying to look at both what we see on the ground and the best ways to open up parts of both our economy and our lives, recognizing that it'll look a lot different than in the past. And there's a reason why, as you talk about tourism and others coming to Montana, look, our tourism industry and those who rely on it are certainly hurting right now. But it's also why in these first phases that we're not encouraging out-of-state visitors to come. And if someone comes from out of state, they're still under requirement while in Montana to quarantine for the first 2 weeks. There's a reason why if you're traveling in from other states right now, you'd see on the highway reader boards, those electronic signs saying if you're coming to Montana as a tourist, quarantine for 2 weeks. Discourage that. There's a reason why we're still having National Guard, soldiers and airmen, temperature checking individuals coming off of airplanes and at train stations to do everything, both temperature checking and telling them that they're under mandatory quarantine order. So what we will continue to do is, as this goes forward, be taking a look at what's happened on the ground, recognizing that the only way that, either the virus, we will get a vaccine, and that's probably the most likely before this is completely gone. So it is going to be part of our lives for some time, and we have to figure out both how to mitigate the spread and the risk, and where there are positive cases, try to do the contact tracing so that we have as little community spread as possible.
Thank you very much, Catherine. We're going to go to Carrie in Redstone. Carrie?
Yes, thanks for taking my call. Governor, what I'm concerned about is my wife's in the nursing home in Pontywood, Montana. And I don't know, but is oil field people exempt from the border crossings? I mean, is it they can go back and forth when they're needed?
Yeah, Jerry, two things. First of all, the oil field, then we'll talk about the nursing homes. That, if you're traveling to Montana for business, and that's been the case even through this closure, that you can come into our state without quarantining for 2 weeks. And one of the things is that as your wife is at a nursing home, that the actions that are expected both of nursing homes and of the employees of the nursing homes remain the exact same as they did before today. And that's that as difficult as it must be, not getting to see her on a regular basis, that not having any visitors, and also having the employees both checking for symptoms, temperature checking, and using the proper PPE or medical equipment to ensure that to do everything we can so that the infection doesn't spread.
Thank you very much, Carrie. Next, and this will be the last question, we have William from Livingston. Go ahead, William.
Governor, thank you for doing this, and I would hope that maybe once a week for the next couple of months you could set something like this up, because obviously there are a lot of questions. As an educator, I realize that it's easy to get confused on which test we're talking about, etc. And secondly, are we getting PPE enough in each of our counties for the workers to do their job?
Thanks for the question, William. So on a regular basis, meaning regular is even a daily basis, that we are surveying hospitals, healthcare providers, and then county disaster emergency services coordinators that also work with our first responders. It has been as an example, until about a week ago, we'd gotten more of these N95 masks from our neighbor DeVeese, North Dakota, than we had from FEMA. And it's something that at the state level, working on literally every day, recently got, I think earlier this week, we got 200,000 KN95 masks, some surgical gloves, other materials. And what we do once we get that material at the state level is we push it out then to the locals in each county. And then the locals in each county, both on the healthcare and disaster emergency services, are regularly reporting back to us what they have received and what they need. And we'll continue to work those supply chains every single way that we can. And because it is important for the health of our first responders, the health of our medical community, and others. So, appreciate the question. And again, I do appreciate all of you taking the time to be on this, that just as the last, 5 weeks has been something where we're constantly monitoring what's happening, trying to take those actions that's best protective of both public health and the needs of Montanans all across the state. We'll continue to do that going forward. That this today doesn't mean the steps that we took means that things are back to normal. And any openings up, there are real expectations that it's a new normal. And we'll continue to monitor exactly what happens along the way and take those steps that are both most protective of Montanans, their health, and our economy. So really appreciate everybody joining us for this telephone conference today. And on behalf of the Lieutenant Governor and I, thanks for taking the time.